And this was the shocking thing that they showed in the survival analysis. They showed that black men in Harlem were less likely to reach age 65 than men in Bangladesh, which of course everyone knows was one of the poorest countries in the world. There is a lot of concern about the development of a vaccine. People are concerned about the safety. They're concerned about whether a vaccine will actually work. And when surveys were done in our communities among African Americans, in many of the communities it was found that less than a third of people would actually be willing to take the vaccine if it was made available. And that had to do with a lack of trust that we as African Americans have in our healthcare system. And the reason for the task force is so that we will have trusted individuals to provide us with guidance in terms of the information that comes out of the scientific studies so that we can assist and support. We as a group believe that there is going to be a safe and effective vaccine that's going to be available. So I'll go into the actual discussion now, if we can go to the next slide. So you may be interested in knowing, and the purpose of these talks, I think, and the purpose of this talk as well as the talks that I give, it's really to stimulate your thoughts, to give you information that will stimulate you to look into this in more depth and to inspire you to do things, to make changes in our community, because it's one thing to see the data, and sometimes when we see the data, it's very depressing, but we can do something about this. We don't want to just sit around and say that it's all doom and gloom. We can do something about this, and so that's really the purpose of this kind of presentation, to present this to you. And we'll start with going over some general areas, and then we will focus on COVID-19. Survival analysis, they showed that black men in Harlem were less likely to reach age 65 than men in Bangladesh, which of course everyone knows was one of the poorest countries in the world. And so these are some potential solutions that we are proposing as we close here. We want to identify reliable, objective sources for health information. We hope that all of you will do that. Your physicians, your professional practitioners, other members of your various groups, identify reliable, objective sources and share that information with your families, with your friends, and with your loved ones. Be proactive in managing your health. And I should say also, as you share information, sometimes you have to have what we call the difficult discussions. And you try to have those discussions where you may disagree, but you try to disagree without being disagreeable. But it's important for us to try to pass on that information that is important for people to hear. Make sure people hear the information that they need to hear and not the information that they necessarily want to hear.
By the month of March, many of us contracted the virus. And the unfortunate situation was that we are considered an essential service, which means we must be out there providing food to the people. But we had no access to any personal protective equipment. We did not have face masks. We did not have anything to protect ourselves. But we were out there every week saving the community. We tried as much as we can to reach out to the Department of Health. We reached out to city council members. We reached out to the mayor's office. We told them that we were in need. We told them that we were, many of us were getting sick. But we were told that much attention was being given to hospitals and other health care. So the food pantries and the soup kitchens we were working without any assistance. And being a compassionate program, we had to be out there providing services to the people. And so our voices were not heard. And like I said, many of us eventually contracted the virus. Myself, my wife, my son, who works in the food pantry, we all contracted the virus. And by the month of April, we basically had to close. We shut down because so many of us were sick. But thank God we recovered, and we got. We did reach out to Robin Hood Foundation, who gave us a grant, and we were able to get some protective equipment, which enabled us to restart the pantry first week in May. I want to say that COVID-19 really exposed the challenges, all the disparities that exist in the South Bronx. And the South Bronx, being a poor neighborhood and not really having a voice, we were not able to really proactively advocate for ourselves. And it is my hope that with this webinar, we'll be able to think as a community and see how, we can be able to design and come up with ideas and ways that can enable us to continue to provide the much needed services in our community and to have a strong voice and to be able to draw attention to the plight of our community residents.
What should we be concerned about, and how is it going to be handled? Can we trust that this can be handled properly?
Yes, I think that we can trust that it will be handled properly, and I'm glad that you were asking that question. There are so many things that we can do as we are waiting for the approval of a vaccine or vaccines as far as COVID is concerned. But as far as the flu is concerned, every year we know that during the fall, especially in the fall and the winter, we almost always will see outbreaks of the flu. The flu is preventable, and although there has been some skepticism by many people about the flu shots, I urge everyone to take the flu shots, to make themselves, to give it to yourself and also to your families. Also, it is one of those immunizations which should be given to our pregnant women. And we know that the flu during pregnancy can be extremely dangerous, and we should encourage our young women during pregnancy to obtain the flu shots from their obstetricians. And even our young children, our infants, 6 months of age and older. I've made sure that my grandchildren have received it, and I would urge everyone to make sure that their children receive it as well. And that is one of the positive things we can do, because the flu can cause a disease that can mimic COVID and vice versa. So that's one of the things we can do.
All of you for being here today, and especially to Dr. Hewlett for accepting to speak to us today. We hope that you enjoy the presentation and that you will make yourself available so that you can continue with us for the next couple of weeks. God bless you. Thank you.
Reverend John Udo-Okon, founder and convener of Word of Life International. They do amazing work. I've been there. I spend my Saturdays there, in more recent times, and just seeing the amount of work that Reverend John and Reverend Felicia put into the community, and they've been doing this for over 17 years. It's just simply nothing short of amazing.